What's up guys, my name is Tristan from the CPAPstore.ca. Today we're going to be looking at every ResMed mask. I noticed that in our store we've just opened in Surrey, BC, that customers will come in, new customers to CPAP, they'll look at the wall of masks and they'll be like, what is going on? But they don't necessarily want to ask, what is the difference of every single mask you sell? Because I think they feel like they're going to be a burden on our staff. So they'll just say, oh, what's the difference between this and this? And what's the difference between this and this? And they'll try to piece it together. So hopefully this video will show you the difference of every ResMed mask on the market and allow you to make an informed decision before you go into your CPAP store or before you come to the CPAPstore.ca online. Now this video will not cover legacy masks. So if I looked at every ResMed mask ever sold, for example, the Quattro or the Mirage or the Swift, going back the last 20, 30 years. This video would take too long. So this video will only include the current line of ResMed masks. Also with the Air Mini has the same ResMed mask, but they're slight different iterations sometimes. For example, the P10 has a different front tube on it like this. So I'm not gonna be covering over those specific iterations of the Air Mini mask, but they are the same in terms of fit, comfort, feel as typical ResMed masks. And if you want to use any mask with an Air Mini, you just get an adapter like this. So this is an Air Mini adapter. You put it like that, and now you can connect any standard tube to the Air Mini just like that. Okay, now it's time to get started with our full face mask from ResMed. So they have the F10, the F20, the F30, the F40. What's the difference? Well, the F10 is a legacy mask, so I'm not going to be covering it. It's an older mask. It was replaced with the F20. So let's talk about that first. This is the F20. ResMed has two variations with some masks, F20 included, Air Fit and Air Touch. So your Air Touch version is going to have like a memory foam outside here, whereas your Air Fit is going to just have your silicone. Okay, so you can just think about the Air Touch as being the softer, nicer feeling version of the mask, whereas the Air Fit has the stickier silicone. It is probably one of the more standard versions of a full face mask. This is like the traditional CPAP mask. Some people feel that it goes over their nose a little bit too much and it pushes the top of the nose. So I'm kind of in that category where it pushes the top of the nose and makes it harder to breathe. Typically in that case, you want to size up your cushion because it's probably a little bit too low, or it just doesn't work for you. A lot of people though, the F20 is probably our most popular full face mask. It has a very, very high compliance rate. So it fits with most faces because it's such a traditional design. And it's also very good if you're at a higher pressure. So if you're looking at a mask and you are at that 15 pressure, or the doctor prescribed your pressure, it's in that 15, 16, 17, 20 range, F20 might be a good mask for you. You have your 360 ball joint and swivel at the front and a quick release in the front there. Now the F20 does have quiet air. So if you look really closely at this area, you'll see a little bit of a filtery design and a bunch of tiny little holes inside here. So that allows it to have a lot more dispersed, diffused air when you're exhaling out of it. So it's not gonna really blow your partner in the face. ResMed masks are known to be very quiet and very diffused compared to other masks like Fisher & Paykel masks, which typically don't put as much diffuser technology in them. So typically they just run tiny little holes. There's pros and cons with each style. The quiet air on ResMed mask makes it nice and comfortable and quiet, whereas the little holes just on Fisher & Paykel masks make it a lot easier to clean. The F20 has a pretty standard headgear. It has magnetic clips at the front just like so. Good for people at higher pressure. Fits like 95% of people and comes in the Air Touch and Air Fit versions. Now, the next mask is similar to it, and this is the F30 mask. So this is also a full face mask, also swivel, ball joint, quick release at the front with the quiet air filter in the front, and fits very, very similarly, okay? When we look at the cushion itself, as you can see, the difference is it goes below the nose. So it's a little bit easier if you want to wear your glasses while reading when you're starting, before you go to bed and you want to have the mask on, or you don't want as many red marks up here and stuff like that. Now, the F30 typically doesn't fit as well or as broadly when it comes to most people. I find that the compliance rate on the F30, or at least with reviews and stuff like that, it's a little more hit and miss, where the F20 can fit a lot of people without any problems. The F30, if you have the right shape for it, really good mask. If you don't have the right head shape for it, it doesn't really work for you. That being said, however, this is, like I said, a hybrid full face mask, meaning it goes underneath the nose. And out of all hybrid full face masks, this is one that holds leaks very well. It holds leaks just as well as the Evora by Fisher & Paykel. So if you're looking for a high pressure, full face hybrid mask, I would definitely consider the F30. It has a nice band up top here. You can adjust the straps, and again, typical ResMed stuff, magnets, all that jazz. Okay, now I said F40. What's the difference? This is the F40. This is the newest hybrid full face mask from ResMed. The main difference of this guy being is the front of it has a very soft cushion. So unlike the plastic hard front cushion of the F30, the F40 full face has an entire full squishy silicone cushion, okay? This makes it a lot more comfortable and it molds to your face a lot better. Again, hybrid mask goes below the nose there. Just like always, it has the quiet air diffuser in the front and a quick release ball joint thing in the front there. Now this ball joint, I guess it's not a ball joint. The quick release tube here doesn't have a ball joint. It does have a swivel rotation and it does have a 360 rotation within the tube, but no up and down ball joint action. I actually like the F40 design a lot better. It's a lot more minimal, a lot quieter. You don't have as much rattle, okay? And you still get almost all the mobility dynamics that you need. Now, when it comes to the F40 versus the F30, they look pretty much similar because they are both hybrid masks here. So as you can see, they look pretty much the same kind of to the untrained eye. The main differences is gonna be that squishy cushion and the front relief tube here. So this tube here is gonna add a little more lightness, a little lighter feel, and your climate line tube is gonna connect onto here. Now, why this is good, it's gonna be a little more comfortable, a little longer, you can move around. It's just gonna feel nice and lightweight. Why it's not good is that because your climate line tube is going here and you have this area of an unheated tube, you could have rain out a little bit in the F40, whereas with the F30, you have your climate line going directly on here. It's gonna be a lot heavier feeling. However, you're gonna have humid air going directly right into the mask. So that might be something to consider. The bigger thing you should consider between the F30 and the F40 is the cushion that we talked about. The F30 being a much more structured mask is definitely better for those at higher pressures. If you have a pressure of 15, 16 and above, you might want to try the F30 first. If you have a pressure of below 15, 16, like a 10, 5 pressure, no brainer, always go with the F40. It's way more comfortable. With the higher pressures, the silicone cushion kind of expands and contracts, doesn't really feel as comfortable. It's a little bit harder to hold those leaks. So if you're at a high pressure, like a 20 pressure, might not be best for you, but definitely at those medium, high to low pressures, the F40 is a really, really good mask that you should consider. Next up, we have some nasal masks here. So first we're gonna start with the N20. This is the N20. As you can see, this one is purple. This is because this is the for her variant. So the for her variants are almost identical to the normal, I guess, for him variants or standard mask. The difference is they come in a different color, purple, but mainly the for hers come in different sizes in terms of different size fit packs. For example, if you get a fit pack with the normal N20, it might come with like small, medium, large, whereas the for her comes in extra small, small, medium. As an example, that could be slightly off, but you get the idea. All these different masks, like there's a for her P10 and for her N20 and for her F20, so they're all a little bit different. But generally, the fit packs are gonna have smaller size variants in there, and then the headgears and the cushions come in smaller sizes as well. Now, the N20 is a very traditional nasal mask, meaning it goes on top of the nose here. So it's very similar to the F20 in the sense that it just goes on top of the face, on top of the nose. And just like the F20, the N20 does fit a lot of people. It's one of the more popular nasal masks. Now with nasal masks, you have to make sure that you're keeping your mouth closed while using them, or else the air in your CPAP is gonna go through your nose and out your mouth. It's gonna dry out your mouth, and you're not gonna have proper therapy. So if you wanna use a nasal mask, because it's a lot more lightweight, a lot more comfortable, and typically breathing in your nose is a lot more healthy than breathing in your mouth, definitely make sure you get a nasal mask and use a chin strap or mouth tape. We don't sell mouth tape because sometimes there can be CPAP complications, so talk to your doctor about mouth tape first, but make sure you're keeping your mouth closed, either on your own or with a chin strap or some sort of tool. As you can see, as always, the N20 has the magnets on the side and a really big structured headgear. So this is really good if you're a side sleeper that needs a lot of support and you're rolling around and you have high pressure. The N20 is probably gonna be one of the masks for you, or one of the best nasal masks for you, because it's gonna hold the mask, the cushion in place as you roll around. You can see the frame and headgear here does look a little bit intimidating, but when it's on your face, it's going like around anything that's sensory input. So it's pretty comfortable. It's not like, you know, sometimes people look at these masks and they're a little bit scared, but when you actually put them on, they're gonna be very comfortable. And sometimes they feel like they interfere with you less because you don't have to adjust them at all because they're a lot more structured than these guys here, okay? In the front here, we have that rotation and a bit of a swivel, just like the F40 mask, but no ball joint and nothing to move around. Now, we don't have a quiet air diffuser, just a bunch of tiny holes. And it should be noted that the N20 out of all CPAP masks is one of the highest blowing masks. So the exhale air blowing out of here might shoot your partner in the face. It's a little bit louder and a little bit more blowier than other CPAP masks. But overall, if you're looking for a nasal mask that goes on top of the nose, has really good secure headgear, and it's very strong with leaks and high pressures, the N20 is a good mask for you. Now, if you're at those lower pressures, you might be able to get away with lighter weight masks. And that's when we come to the P10 and the N30. Now, I know these masks look almost identical. So why is this the P10 and why is this the N30 and not the N10? Simply, there was an N10 back in the day. It's a legacy mask, looks like that. And they obviously couldn't name this mask the N10 because then people would get confused. But the P10 and the N30 are pretty much the same. So the front of the P10 is nasal pillows here. So that's why the P stands for pillows. And basically they go in your nostril a little bit, not like deep in your nostril, but they just seal around the nostril, giving you a nice non-leaky fit. And because of that, and because of the minimal design, this right here is our by far biggest seller. This is the most popular CPAP mask, I think, in the world. It has a very stretchy elastic band here. You can tighten the elastic band as it gets worn out with a little tensioner on the side. And you basically put it on. I'll take off my glasses, I guess. You put it on like this, super easy, done, okay? Just like that. Pillows go in the nose, it's fairly secure, you barely feel it, super, super minimal, okay? Now the N30 is the same way, but it uses just a cradle design, so it just goes underneath here, no pillows, so some people like this, but in terms of like sales and how much we sell and how much they work with other people, the P10 just sells way more. It's way more popular because the N30, because it's a cradle design, is gonna leak more typically, whereas the P10 nodules here, the pillows, really can bend towards wherever your nostrils are. So if this is your first time doing one of these minimal masks, definitely I'd go with the P10 before the N30. Now where the N30 does shine, it's a bit of a newer mask. So the diffuser uses the same quiet air technology as the other mask I showed. So there's a little bit of fabric inside there and a little bit of venting around. So it's super quiet and very easy to exhale out of. The P10 is also very quiet, but it's an older design and they use this plastic mesh material. You can kind of hear it. And this plastic mesh material is simply a little harder to breathe out of. So those who have a hard time exhaling will find that the N30 is actually easier to exhale than the P10, especially if you're at those higher pressures. Now, if this is you like the P10, you find that it's hard to exhale, you might want to change your EPR settings in your mask. So that's your expiratory pressure relief. That'll reduce the pressure on your exhale phase of your breathing cycle. And so a lot of people do that with P10s. Also, if you are not cleaning this mask, if you're not, scrubbing out, this little mesh area, it's going to become even worse. So if you do use a P10 and notice that's an issue, definitely try cleaning your mask and making sure you're on top of that cleaning regimen, because a little bit of dirt in here almost makes it like feeling impossible to exhale out of, especially when you're at those higher pressures. Okay, the last style of ResMed mask we have is the I line. So this is the N30i, this is the P30i, this is the F30i. What do you see in common? The I line basically means that you have a top mounted mask. So this is a tube, this is a hollow tube. The air rushes both sides of your face. When you're on one side, it just rushes on one side of the face. Your CPAP machine is basically a pressure-based system, so it doesn't really matter if you pinch a side and you're on your side, it's gonna deliver you the same pressure in your nostril here, so don't worry about that. The biggest benefit is the top-mounted headgear here. So I have Eric wearing the N30i, okay? And as you can see, if this tube here is connected to the CPAP machine, maybe it's on a nice little tube hook, as Eric rolls around all night long, there's absolutely no tangles because the mount point of the mask is at the top of the head, right? And because the mount point is at the top of the head, when you move your mouth, you're not getting a tangle of tube all the way around. You're just getting it, rotating up here, okay? So that's the main factor with the top mounted masks. Now, where the top mounted mask has the draw side is because you have air rushing next to your ear, and that makes it a little bit louder of a CPAP mask. Some people like quieter masks and they want something like a P10, but then they have a tube in the front of their face all night long. Some people want the tube completely out of their face and they don't mind the air rushing next to them. So to each your own. I really like top mounted masks. I think they're, noise doesn't really bother me too much at all. So I find that top mounted masks are kind of a no-brainer because I also roll around a lot. So now looking at the differences between these masks, you have the N30i with basically just the N or the no cradle, the nasal front cushion. And then we have the P30i, which is, again, you guessed it, the pillows, okay? Typically, I'm gonna err on the side of pillows if it's your first time using a CPAP mask and you don't really know what works for you. Pillows typically have lower leak rates and a little bit higher compliance. Now, if you look at the front, you see the diffuser on both of these masks, making these masks very low wind and low noise. When I say low noise in this context, I'm saying low noise to a partner or people in the same room as you, okay? Because it has the diffuser, it's a very quiet mask. However, like I said, because it does have the wind going next to your ear, to the wearer, it's actually a little bit louder than some other masks. So it's kind of funny because they are a little bit louder for you wearing the mask, but they're a lot quieter for your spouse who's sitting next to you. Okay, so that's something to keep in mind. But they do have the diffuser, so they are very low wind and low noise externally. And then at last we have the newest mask here, which is the AirTouch N30i. So again, it has that nice softness that the AirTouch line is known for, and the cushion itself is lined with this little like super soft like fabric material up front here. Now, most AirTouches are like a memory foam, but the N30i is more of a fabric-based mask. So instead of having full silicone at the top of the head, especially if you're bald or something like that, you have fabric all the way around and nice fabric right where your nose is. AirTouch N30i kind of leaks a little bit more because it's not as secure. Like the normal AirFit version, the sticky silicone really kind of sticks to the front of your nose, where the fabric one I feel like is a little more slippy, but is definitely more comfortable. The N30i AirTouch is probably one of the most comfortable CPAP masks on the market because it's minimal, it doesn't have a lot of straps. Because it's a hollow frame design, it's actually quite secure. And then it has the full fabric, so you don't have that silicone on the top of your head. But it might be something that is best with medium to lower pressures. But because it's so new, I don't really want to talk on that yet because not enough people have bought it. It's not even available in Canada yet. So we don't really know what the data and people's feedback, the good and bad for this mask, but I really like it and I think it's really comfortable. At last, for the top mounted mask, we have the F30i, which is very similar to the F30, but it's the top mounted variant, okay? So those are the masks from ResMed. I hope this helps pick a mask for you. Picking a CPAP mask can be very difficult, but it is the most important part of CPAP therapy. So most people do have to try 2 or 3 masks before they find a mask that works for them that they can use like no brainer for the next 10, 20 years. But if you are starting CPAP, yeah, it's gonna be a little bit annoying trying to buy and use all these different masks and trying to find the best one for you. One thing to note is before you buy like a whole bunch of different masks to try and then you don't like it and you try a new one and don't like it, try to buy some CPAP gear that's gonna help you no matter what mask you have. For example, a Raptor tube hook keeps the tube out of your way. So regardless of what mask you choose in the end, a Raptor tube hook or any tube hook is gonna enhance the experience. So you might as well buy that first and use it with your CPAP mask because at least that's gonna stay constant and then you can properly test your mask and hopefully not buy as many overall during your entire testing beginning period, okay? I hope this video helped. Please subscribe if it did, and I'll see you in the next video.